A woman becomes a mother in the very moment she realizes that she is pregnant. A man becomes a father when he holds his baby for the first time. Hello and Namaste. I am Dr Sugandhi Unnikrishnan, MD, OBGYN, and welcome to KimKena. Here, we try to bring you about a combination of evidence-based medicine and practical solutions to daily health challenges in a way that is understandable and relatable. This is the moment you've always waited for, prayed for, and hoped for. The moment when you see those two pink lines on your pregnancy test. It is positive. You are pregnant. After the initial surge of emotions, reality sinks in. You realize there is a life growing inside you and that you are responsible for it. Then you start asking yourself a slew of questions. What do I do? Whom do I ask? Where do I go? In this video, I'll try to answer all your questions and give you 5 quick pointers you need to keep in mind when the pregnancy test comes positive. So let's begin. Point number 1. Confirm your pregnancy. If you are seeing 2 dark lines on your pregnancy test, it usually means your pregnancy is strong and positive. However, if one of the lines are faint, it would be wise for you to repeat the pregnancy test after a few days. The other option is to go in for a blood test. It is called the Beta HCG Test. This test normally does not require a prescription and you can get it done in any of the diagnostic labs near your home at your request. The Beta HCG test detects the level of the HCG or the pregnancy hormone in your body. Levels above 25 indicate a positive pregnancy, levels below 5 are negative for a pregnancy, and levels in between 5 and 25 are in a grey zone. However, I request you to leave the interpretation of the beta HCG value to your OBGYN. Take your folic acid supplements. If this was a planned pregnancy, it is very likely that you've already been taking your folic acid supplements, and that's a very good thing. But if this was an unplanned pregnancy, I request you to start off on folic acid supplements immediately. You don't require a doctor's prescription for this, and folic acid is easily available in any local pharmacy near your home. Folic acid prevents neural tube defects in your newborn and also reduces chances of unexplained miscarriage. So please start on folic acid and continue taking 1 tablet every day for the first 3 months of your pregnancy. Point number 3. Book an appointment with your doctor. Now I know that most of us are reluctant to step into a hospital in these pandemic scenarios. However, the good news is that you can connect with your doctor virtually through a video consult. Your doctor will ask you basic questions about your medical, surgical, and pregnancy history in the past or in the present. You will also be advised some blood test, what is called as the antenatal panel. The rationale behind asking these questions and advising these blood tests is to identify any condition that can increase the risk of complications for you or your baby. You will also be advised an ultrasound, what is commonly known as the early pregnancy or the dating scan. The scan is done at around 7 weeks of pregnancy and it is done to see if your baby is growing well, growing normally and safe inside the uterus, to help the doctor calculate the EDD or the expected date of delivery of your baby, to check if it is more than 1 pregnancy like twins, and the icing on the cake is that you get to see and hear your baby's heartbeats. Sheer bliss. Point number 4. Prepare with your questions. Write down any kind of doubts or questions you would like to ask your doctor much before the appointment date. It is highly recommended to do this so that you can have a fruitful and productive conversation with your doctor. It should not happen so that you step out of the consultation and realize that you've missed asking an important question that has been nagging you. Your doubt can be trivial or serious. It can be general or COVID related, but please go ahead and ask it. Asking doubts and getting answers will help you take better control of your health and your pregnancy journey. We are also here to clear your doubts for you. You can write to us at ask.kimkena@gmail.com and we will be more than happy to respond. Point number 5, making pregnancy announcements. Now I know that the moment you see those 2 pink lines, you want to shout out from a rooftop that you are pregnant. I would suggest something else. You can share this happy news with your immediate family members and your core support group, but reconsider posting it on social media until you have met your doctor and your blood tests and scans say that your baby is doing well. It will also be a good way to prevent you from getting overwhelmed with all the pregnancy advice overload. So these were my top 5 pointers for you to keep in mind when you get that positive pregnancy test. Confirm your pregnancy, take your folic acid supplements, book an appointment with your doctor, ask the right questions, and make the right pregnancy announcements. Please write to us at ask.kimkena@gmail.com with your inputs, suggestions, or any kind of queries. We will be happy to respond. You can also write your comments on the comments pane below. Sharing this video will help you to reach out and support someone who needs it. A like and a subscription will help support me to create more such content for you. So until we meet again, keep calm, good luck and good health.